Good morning.
Good morning.
Alison, great to have you here. We are here, we're going to speak to Allison Barr from Team Jack Foundation. So tell us about the Team Jack Foundation. So tell us, how are you here? How did you get here? Tell us about your organisation.
So Team Jack was born by my amazing son, Jack, who was 15. He had been fit and healthy, and sadly in summer of 2014 took ill very quickly and was diagnosed with a very rare and aggressive form of cancer. During that time, Jack felt that the medical care was outstanding, but that there was no emotional and social support available for young people going through cancer. So he was getting given money from people, and he turned to his granddad and said, go and just open a wee treasurer's account, and when I get better, we'll do something to support other people. Then unfortunately we got the news that he wasn't going to get better, and within the 10 days when he knew that he was dying, he set out this massive big list of things that he wanted for his charity, Team Jack. He named it, right. And he said he wanted a safe space for young people to come, because obviously people going through cancer can't go to public places for fear of infection. And he wanted counselling, he wanted sibling support. His big sister, he felt, was very isolated. Support for friends, because again, you know, they weren't supported. Bereavement support, support in hospitals and schools as well. And everything that he listed is now in fruition within Team Jack.
I mean, wow. That is absolutely, I know it's amazing. It's wonderful. Just sounds wonderful. And then just start to ask about membership. So you're a member of SCVO?
Yes.
What have you made use of with us with membership? So what's kind of been the thing that you think, right, this is the one thing that SCVO does for us, but also is there something that you think, actually I'd really like SCVO to be doing this?
Funding Scotland's a brilliant one for us, you know, where we go on and obviously have a good look every week. You know, the wee email comes through, and quite often it's 2 a.m. when I'm not sleeping, so I'll be like, oh, that's perfect, and I'm sitting working out what I can use and what I can't use. When we were opening Jack's Den, we consulted with SCVO to get an architect and law advice for the contracts and things, and they were really, really helpful there as well. We had a really lovely experience with the Charity of the Year as well. So I've had quite a lovely experience with SCVO actually, and I would say the whole thing is just, I think having been in the teaching profession, I'm used to having an umbrella body and, you know, being part of something that's very compliant and very structured. And I think within the third sector, I think that's given me peace of mind to know that if I'm following the things that SCVO have got in place, then hopefully I'm doing something right.
I've got two questions around. One is around the fair funding. So SCVO has been doing a lot of work on fair funding. You'll know that as a trustee as well. And that really is thinking around more multi-year funding, more sustainability, more flexible funding, and making it more accessible to charities to be able to go out there and get what's available. So for you with Team Jack, where does that sit for you?
Oh, absolutely 500%. You know, we're at the point now where we have got a few multi-year funding grants.
Congratulations.
However, you know, we are getting to the point now where, and I think this is a big issue for charities that are well established like us now, you know, we're now in year 11. At the beginning it was very much, you know, oh, you're still quite new, you know, we're not going to fund you till you prove your worth. Then you get the awards, and then it's like, oh no, actually we're going to now fund newer charities because we want to develop the grassroots. And then you're kind of left going, oh well, oh my goodness, what's going to happen now? And then we reached this horrible £500,000 threshold a couple of years ago. So it now means that a lot of the grants that we had before were now not eligible to apply for. And I've never ever been complacent over grant funding, but I think especially since COVID, I think a lot of charities like us do rely on grants, and I think the multi-year thing is just vital to know that you're going to have that money for your staffing, for your resources. It's vital. It's absolutely vital.
Absolutely. And I think there's something around covering core costs as well, isn't there?
Yes.
That's the key thing, is being able just to know that you can pay staff, that you can cover core costs, as well as so it's not just always about the new thing. What's the new thing you're doing? What's that additionality that you're bringing, which is quite interesting.
I actually think that's, and forgive me for saying it, I think it's a short-sightedness possibly on the funders' point, because actually to have to keep reinventing yourself and reinventing projects and things when actually all you need is core funding to be able to continue to do what you do and then develop what you're doing further when it's working really well. You know, it's a constant battle, you know, to just exist.
And can I just follow up on that? So no, interested, have you done much around income generation, diversifying that income stream? Like, can you tell us about some of the things you've been doing there? Because I think that's one of the big challenges, right, for the sector as a whole. Obviously, we talk about fair funding and that grant element, but there's also, I think, a growing need for charities to think about how you bring in a sustainable income source and how you diversify that. So just interested in what you've done.
500%, yeah. We're actually in the middle of doing a schools wellbeing outreach programme. Thankfully, I've got the skills as a teacher. During COVID, I've kept my GTC registration going because you just never know. But I had to do my professional sign-off year. And during COVID, I wrote a Bag of Worries programme for our children because we'd had 42 children online throughout Scotland, all worrying about their cancer journeys, their siblings and things, and also the COVID, the effects of. So I wrote this programme and have piloted it in schools. I wrote it so that it could be done in a one-to-one, a group situation or a whole class situation. We've been using it within Jack's Den, we've been using it online with children, we've been using it in schools, and we've got a warrior one and a sibling one for in hospital as well. So a number of schools that we've worked in have actually said to us afterwards, we can see the value in this, could you come in and do it with other children, other classes? So we said, well, yeah, but you'll need to pay us for it. So I really see a niche there. You know, unfortunately, it's like everything. They're 10 a penny, the wellbeing programmes in schools. But as a teacher, I know that no one resource is going to fit everybody. So therefore, what we've got hopefully will provide something different for children that need it. And I think it's about trying to get that out there in the forefront of what we're doing. Very lucky or not lucky for the situation that happened, but we're actually working, we've got a contract, Public Scotland contract with West Calder High School, because we were supporting a whole load of peers in there of a child that sadly died a couple of years ago. And again, the school staff saw the difference that it was making to these children. So we now go in one day a week and present wellbeing to every class in the school, along with taking small groups and individuals. So it's this mid-level emotional support that's missing both within schools and NHS. But it's about how we do that, you know, because you're absolutely right, coming back to what you asked about the income diversity and things, you know, you can't rely on grant funding, you can't rely on one source of income anyway. But grant is definitely going downhill. Your community fundraising, people's money, cost of living is getting less and less, so people are not attending events as much. We had 370 at our ball last year, we've got 180 this year. You know, it's crazy. So it's about looking for something that's your niche. You know, lots of other charities do cafes or, you know, second-hand shops. Our niche is our ability to go into schools and hopefully make a difference to all these amazing children, but it's how we get in there and then develop it at the moment. That's the stage that we're at.
I've just got a couple of questions around staff as well, about kind of off the back of our voluntary workforce survey. I think you said 11 years that you've been in existence. So what have you seen staff-wise in changes with, again, mental health and wellbeing? Because that's a big thing that came out of the survey around burnout, cost of living, people feeling that their wages are not covering costs. But again, we know we've got funding issues. So what have you seen over those 11 years?
It was really heartening. I attended the Harmony House briefing yesterday, and they put a picture up of a revolving door, and I actually burst out laughing because I've been there, you know. And I think for all the reasons that you just said, you know, people are not happy in their own lives, the cost of living. They maybe think, and I'm not saying this about my staff because they're fantastic, but I think in the past it maybe has been the case where they maybe think charity's an easy ride. They've maybe got this entitled theory where, you know, they feel that, well, actually, I want the flexibility, I want this, I want that, but they're not actually understanding the needs of the charity. Yeah. And I think to me, it's been a massive learning curve for me, especially in the last year and a half. I've changed my whole leadership style because I have now seen that actually you can't sit back and you know, do whatever. You can't give them a structured thing. You've got to work with them. Yeah. There's all the neurodiversity issues at the moment. We've got a number of staff that are now realising that they've got ADHD or other neurodiverse conditions. So it's about then having to make sure that I'm dealing with different styles and putting in procedures to make sure that we are supporting all the staff, but also getting the job done. So it's an absolute can of worms. It's really, really hard.
Well, that maybe brings me on to some of my questions, which were around leadership. So I'm interested, I guess in your own leadership journey, which, you know, you've told us a bit about the story, so I can appreciate that you've come into this carrying your son's legacy as well. So that's a really different aspect, I think. But there are other organisations out there founded under similar circumstances. But really interested in your own leadership journey and what you might say to other people who, you know, are embarking on that due to tragedy potentially, but actually out of that you've obviously done something that's changing the lives of hundreds of thousands of, you know, people across Scotland.
Absolutely. I would say leadership's a very lonely journey, and I didn't appreciate that. I think because I had been within a school and the umbrella and the safety of a school before and working well with other teachers, and obviously a lot of that you're actually just managing yourself anyway because you've got your class of children. So I think for me, realising that actually, you know, I'm quite a sociable person. I like, you know, getting on with people and finding out what they're doing and talking about what we've been doing. And I think that was really hard, making that differentiation between, you know, being the leader, but also being a manager, but the difference between leadership and management as well, you know. It took me a long, long time to get that into my head and understand it. And as I say, I think I probably was this close to walking away a few months ago, because I felt that it was me that was causing all the problems, because I wasn't leading properly and I wasn't managing effectively. I was managing rather than leading. And
I guess, obviously, you probably had to really go through your own resilience journey on that.
Yes.
Is there anything you would say to people who are maybe feeling a similar place? Because I think our recent survey highlighted that there's a number of people thinking about potentially quitting the sector, you know, or leaving their roles. And so I don't think that experience is unique, unfortunately, to you, but anything else that you're taking away?
Yeah, I think trust your gut, know your why, keep that at the centre of everything, and don't do it alone.
Great advice. That's really good advice. Yeah, I thank you so much for that. I think we've just got a couple of questions to kind of wrap things up.
So 3 words to describe Scotland's essential voluntary sector, Alison. So for you, what does Scotland's voluntary sector mean to you?
So I thought long and hard about this, and I think 3 words don't really sum it up, but I think to me it would be vital, challenging, but awesome.
Those are good 3
Sounds
words.
great. Those are 3 great words. And I guess clearly not your first gathering, but for this gathering, what are 3 words that you'd use to describe the gathering?
I would say reassuring, empowering, and exciting.
Excellent.
Well, that is fantastic. Alison, thanks so much for joining us today. It's been great to chat to you.
Thank you very much.
Thank you. Thank you very much, Alison.
Thank you.
Thank you.